Welcome to Cancers 101. I'm your host, Ritika, and today we are exploring a silent but dangerous threat to cancer patients fungal infections. These infections are often overlooked but can have severe consequences for those with weakened immune systems. I'm joined by Aditi, an expert in cancer immunology. Aditi, why are fungal infections such a big concern for cancer patients?
Great to be here, Ritika. Cancer's treatment, like chemotherapy and organ transplant, suppress the immune system, making patients more susceptible to opportunistic fungal infections. Aspergillus and Candida are the main culprits. These fungi don't usually pose a risk to healthy people, but in cancer patients with compromised immunity, they can cause severe infections, particularly in lungs or bloodstream.
It seems like chemotherapy and immunosuppressive treatments create the perfect environment for these fungi to thrive. But what exactly is it about these treatments that makes the immune system so vulnerable?
So, when patients undergo chemotherapy or take corticosteroids, their immune cells, especially neutrophils and macrophages, are weakened or reduced in number. Without these cells, the body struggles to defend itself against infections. Plus, chemotherapy targets rapidly dividing cells, and since immune cells are some of the fastest growing, they get hit hardest. This leaves a window for fungi like Aspergillus and Candida to invade.
So it's like taking down the body's frontline defense. But these infections often go undetected until it's too late. How do doctors diagnose these fungal infections, especially when the symptoms overlap with other conditions?
It's a challenge. Symptoms of fungal infections can look similar to pneumonia or other infections, fever, cough, and shortness of breath. However, because cancer patients are already immunosuppressed, their symptoms might not show up as strongly as they would in healthy people. This makes early diagnosis difficult. Blood cultures often don't yield quick results, and CT scans or fungal biomarkers are used to help pinpoint the infection.
It sounds like diagnosing these infections is a bit like solving a mystery. Once a fungal infection is detected, what's the treatment like? How do doctors fight back?
The primary treatment is antifungal therapy. Drugs like voriconazole and fluconazole are used to target the cell membrane of fungi. For severe cases, doctors may use amphotericin B, though it can be toxic to kidneys and liver. In some cases, echinocandins, which target the fungal cell wall, are also used. There's also the option of prophylactic antifungal treatment for patients undergoing chemotherapy or other high-risk treatments. The goal here is to prevent fungal infections before they have a chance to develop.
It's a combination of treating existing infection and preventing future ones, as I assume. But there are any new advancement in diagnosis or treatment of fungal infections for cancer patient?
Yes, there are some exciting developments. New fungal biomarkers are being studied to detect infection earlier. These biomarkers can be detected in blood tests and may lead to quicker diagnosis. Additionally, combination therapies are being explored where antifungal drugs are used alongside treatments that help boost the immune system. There's also increasing research into the role of gut microbiome. Restoring the balance of bacteria in the gut might help protect against fungal infections.
It's amazing how the body's microbiome can be a key player in preventing infection. But let's bring this back to the patients. Aditi, what's the one thing you think cancer patients should remember when it comes to fungal infections?
So, the key takeaway is that fungal infections are preventable and treatable, but early detection is crucial. Prophylactic antifungals can help prevent infections, especially in high risk patients. And if a patient notices any symptoms like fever or cough, it's essential to report them to their healthcare team immediately. Early treatment can save lives.
That's really helpful advice. Fungal infections may not always be in the spotlight, but they can certainly cause serious complications. Thank you so much for sharing your expertise with us, Aditi. Thank you so much to our listeners for tuning in to Cancers 101. Be sure to join us next time for more insights into cancer care. Until then, stay informed and take care.